Singapore plans to expand the number of kidney patients using home-based peritoneal dialysis by 300 over the next 3 years. This will offer greater flexibility for some of them to continue working and caring for their families. The Health Ministry says it hopes to raise the number of new patients on the treatment to 1 in 3, up from the current 1 in 5. These efforts will be led by the National Kidney Foundation and 4 public hospitals. Elsa Stung with more.
Watching this 60-year-old go about his evening routine might make you think he's a seasoned healthcare professional. That's because Mr. Murad Muhammad Taha has been doing his kidney dialysis from home since 2023. The treatment involves daily sessions for 9 hours each time, and he can do it by himself, with a nurse visiting him just twice a year.
When I do it at home, while I'm doing the dialysis, I can have my family members, my wife, my daughter, my sons, to sit around me and we can sit chit-chat. Yeah, compared to at the NKF center. And I don't have to rush to a dialysis center for the blood dialysis.
But patients like Mr. Murad who opt for peritoneal dialysis are a minority. According to the Health Ministry, just 1 in 5 new patients opt for this treatment. Most patients cite a lack of confidence to perform the treatment themselves, preferring to leave it in the hands of medical professionals. MOH hopes that in the next 3 years, it can raise the number of new patients using home-based peritoneal dialysis to 1 in 3. As centre-based treatment is resource-intensive, doing it at home helps to reduce capacity pressure on such facilities.
Kidney failure is one of those most challenging medical conditions. It reshapes daily life physically, emotionally, financially. This is why we hope to progressively increase uptake of peritoneal dialysis, or PD, for suitable patients. PD allows dialysis to be performed at home, offering greater flexibility and enabling some patients to continue working and caring for their families.
NKF, together with 4 public hospitals, intend to have 300 patients on this treatment over the same time period. It's also stepping up preventive efforts. This new centre helps visitors understand how kidney disease develops and the influence of early lifestyle changes on its progression, especially when kidney disease often comes on the heels of other illnesses, such as diabetes.
We train students and children to be our champions, telling their parents at home that they want to eat less sugar, eat healthily, maybe French fries without salt. We hope that in Singapore, we will pay attention to our health, exercise regularly, eat healthily, and have a purpose and be mentally fit as well, so that you don't have the fate of having diabetes.
As chronic kidney disease often lacks obvious symptoms, many patients are diagnosed only when it's too late. NKF says these upstream efforts are aimed at reducing the long-term burden of advanced kidney failure in Singapore.
And to share more on the shift towards home-based dialysis, I'm joined by Associate Professor Tan Chieh Suai, who is Head and Senior Consultant of the Department of Renal Medicine at the Singapore General Hospital. Prof, great to have you with us.
Thank you, Angela.
Now, first of all, let's start with what the difference is between peritoneal dialysis, or PD, and hemodialysis. What is the difference here?
Essentially, our kidney works by removing toxin and waste excessive water from our body. And what peritoneal dialysis and hemodialysis does is to replace the function of the kidney. Fundamentally, hemodialysis involves the removal of the toxin from the blood 3 times a week in a center in Singapore, where peritoneal dialysis is actually involved putting a tube in the tummy and using our own body's lining to remove toxin from the body. Essentially, both are effective, but what is different is that the PD is actually a home-based therapy, allowing the patient to do the treatment at home. On the other hand, in hemodialysis is where patients actually build their life around the dialysis schedule. And therefore, PD actually allows the patient more freedom to do what they want to do
And that's also reflected in the case study we saw earlier, where the patient felt heartened by the family being able to be around them at home. But at the same time, we know that there's quite low patient take-up for peritoneal dialysis done even in the comfort of home. So why is that? Are there any misconceptions that the patients have about it?
I think it can be divided into three areas. Number one, awareness. Many patients are not aware of this possibility of peritoneal dialysis because hemodialysis is so prevalent in Singapore. You go to many housing estates, you can see a hemodialysis center, but peritoneal dialysis is done at home without the knowledge of many people. Secondly is the perception of PD being inferior to hemodialysis, which is not true because many studies have shown equivalent results in both cohorts. And thirdly is the lack of self-confidence. Imagine you're diagnosed with a catastrophic illness and yet you're told to do this treatment at home yourself. The patient naturally will feel frightened, afraid, and have no lack of confidence in doing it. And some of the common questions or pushback I heard from the patient is, are you sure I can do it at home? What if I do it wrongly? What will happen to me? So these are the concerns that a lot of patients bring up when we give them the options of peritoneal dialysis.
Yeah, I imagine it can be quite overwhelming, to do it for the first time by yourself at home without any supervision. So how will NKF's PD program then help to support these patients and to address these concerns and these problems on their part?
So when we were first approached by NKF to do this together, we were very excited because traditionally in our hospital, the patients come to the hospital to learn how to do peritoneal dialysis and then they go home and do the treatment themselves. The difference is with NKF nurses embedded with us, we are now able to bring the nurses to the home of the patient to help them through the entire process from the time the tube goes in. The nurses will go to their home, help them look after the tube, assess their home condition and help them set up the dialysis at home. And with this hand-holding up front in the treatment, we hope that the patient will be able to do their treatment confidently and without any mistakes.
That definitely builds confidence at the onset, and later on they can start doing it themselves.
And in fact, a lot of patients, after they start in the initial phase, they say, in subsequent months, they say, you don't need to come anymore. I know exactly how to do it. And that is the kind of outcome that we want.
Yeah. So, but we know that the kidney disease cases are on the rise in Singapore. Is the existing infrastructure sufficient to cope with current and even future demand, you think? And how does all of this tie in?
So definitely we have sufficient infrastructure to support our patient with kidney failure in Singapore. What peritoneal dialysis offers to the patient is an option to find a treatment that is most suitable for their lifestyle. And if more patients choose to do peritoneal dialysis, then the pressure to build more dialysis centers will actually comes down and there will be more capacity all around. But the main impetus is not to relieve infrastructure crunch, but the main impetus is to give patients more options to find a treatment that really suits their lifestyle.
Yeah, to be more empowered as well, to take charge of their illness. Now, what more do you think, before we go, needs to be done to raise awareness about kidney disease detection, especially from an early stage?
So in Singapore, 2/3 of the kidney failure is due to diabetes. And definitely to reduce kidney failure in Singapore, we need to reduce the incidence of diabetes. And that's through healthy lifestyle, regular exercise. And if the patient do unfortunately develop diabetes, then it's important to get the diabetes under control. And we now have very effective medication that can reduce the rate of progression of kidney diseases. So these are things that we need to do to prevent patients from getting diabetes and to treat their condition aggressively. Beyond diabetes, in patients who have hypertension, who have high blood pressure, or who are obese, or have family history of kidney diseases, then they should go for early screening because early detection can allow us to treat the illness earlier and prevent progression. Lastly, if the patient develops blood in the urine, bubbles in the urine, or lower limb swelling, it's time to see a doctor. Don't wait.
Yeah, early detection is really
Definitely.
key. Prof, thank you so much for sharing your insights with us today. I've been chatting with Associate Professor Tan Chieh Suai, who is a Head and Senior Consultant of the Department of Renal Medicine at the Singapore General Hospital.